Hello, I am Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California, and an expert in diagnosing and treating musculoskeletal injuries such as carpal tunnel syndrome. And here is my promise to you today. I'm going to give you what you need to know about your carpal tunnel injury in order for you to completely break out of the injury cycle and find freedom from your pain. I promise by the end of this webinar to give you the next step to be able to fix your injury for good. And finally, I promise you more enjoyment out of life, less frustration with your computer work, and more satisfaction with your exercise and hobbies that will no longer be hindered by your pain. Is that a bold promise? Yes, it is, and I will keep it. But first, I have a very special free gift for you for staying with me to the end. Please take a moment before we dive in to silence notifications on your cell phone and other mobile devices, and close out Skype and other browser windows that you may have open so that you can give your full attention to this material. The reason I am giving this webinar today is because I hear so often from my patients things like this. Oh my gosh, I had no idea that I could ever get better from this. I've been to my MD, I've been through PT, I've tried icing and stretching, and I've had an ergonomic workstation evaluation done, and I wear wrist braces at night so I can sleep without the pain waking me up, and nothing has ever helped. I came to you because you helped my coworker with their wrist pain, and I was skeptical. But I already feel way better after the first treatment. Why didn't my doctor tell me about you in the first place? And I understand that frustration. Not only do I have a high success rate treating this type of injury in my spine and soft tissue clinic, I know what it's like to suffer with an aggravating injury and not know where to turn for help. 10 years ago, I was a civil engineer working at a job that I couldn't stand. I tolerated various jobs in this field, sticking with them because they paid the bills and were predictable, but I never found much fulfillment in them. I figured I would just kind of keep slogging along until retirement, until I developed a burning pain in my forearm and in my hand when I used the mouse. Even after PT treatments and ergonomic keyboard adjustments, my injury got worse until I couldn't even hold the mouse for more than 10 seconds without feeling like I was just going to scream. I was doing the recommended stretches, but they wouldn't help for more than a few seconds. I was so angry and frustrated with work, and I even got to the point where I was pretending to do work, but I was actually avoiding my keyboard and my mouse. Even worse, I couldn't grip the handlebars of my mountain bike. As an athlete, this was so aggravating since biking after work was a huge source of endorphin release and stress relief for me, and I was so angry at my job for causing this injury. After having a hand surgery and following up with more PT, I was still having pain and finally reached a point where I couldn't stand it for one more day, and I quit my job. On a whim, I enrolled in massage school. It had always sounded like a fun, hands-on type of skill to learn, and I had no idea what path to take next, so I thought, why not? The engineer in me thought that this was a ridiculous path, but my right brain and my intuition signed those enrollment papers. Within the first week of massage classes, I felt like I jumped down a hidden tunnel in the Super Mario Bros. Game. You know, the ones that open up into new worlds full of stars and gold coins and new tunnels that you haven't yet explored. I started to see the emerging possibilities of starting my journey towards becoming a physical therapist, a chiropractor, or maybe an osteopath. I knew it was time to make a decision. I could take a few months off and then get another civil engineering job and slog along for another 10 years hoping I didn't get any new injuries. Or I could choose to jump down a new tunnel. I chose the bright green tunnel that deposited me into Life West Chiropractic College. There, I learned that there are natural hands-on methods to treat repetitive strain injuries just like the one I had that could have possibly prevented the need for surgery. I learned that there are ways to adjust joints and work on muscles that could have alleviated the pain caused by a knee injury that I developed when I was a young soccer player. I learned techniques that could have saved me months of popping Advil and hobbling around in a full leg brace and still feeling chronic knee pain today as an adult. And until I learned about how to accurately diagnose and treat musculoskeletal injuries, I went through the same ringer that so many of my patients have been through. And I want to save you that aggravation and that frustration that I had to put up with for so long. So let's dive into what carpal tunnel is. So I just want to clear up a common misconception. Everybody has a carpal tunnel, but it's only when a problem develops that you would say somebody has carpal tunnel syndrome. Now, true carpal tunnel syndrome is when there is too much pressure in your wrist and it's squeezing down on the median nerve, creating symptoms of pain, tingling, or numbness in the wrist and in part of the hand. The median nerve runs through the carpal tunnel. And the reason it's called a tunnel is because it's made up of little bones in the hand called carpal bones arranged in an arch. The roof of the tunnel is called the transverse carpal ligament. And here's a better picture of it. The problem with the term carpal tunnel syndrome, however, is that it's a junk diagnosis. Most primary care doctors classify any pathology that is causing symptoms in the thumb and the first two fingers as carpal tunnel syndrome. But this puts all the blame on the transverse carpal ligament. It's blamed for putting too much pressure on the median nerve. But guess what? The median nerve forms out of a plexus of nerves in the neck, and it runs all the way down to the fingers. On this picture, the nerve roots, which are the numbers C5, C6, C7, C8, T1 over on the right side of the picture, those are nerves that are main nerves coming out from in between the bones of the neck. Now at this point where it starts to get all jumbled up here, a superhighway forms. There's merges and there's exits, and I don't expect you to memorize all these branches of the brachial plexus. We did that in school. There's some fun mnemonics to help jog your memory. We had some good times with that. But the important thing to notice is that on the left-hand side of this picture, the median nerve gets formed out of this superhighway, and then from here it travels down the arm. Did you know that there are at least 3 locations other than the carpal tunnel at which the median nerve can become entrapped? Put another way, if the median nerve was a railway, it would start from the neck and it would run to the fingers, and there would be several stops along the way. Each of these stops are different tissues in the body which, if they become injured through either a single injury or with repetitive use, they can squeeze down on the median nerve and create the same symptoms as carpal tunnel syndrome. And guess what happens when a person tries everything under the sun and finally resorts to surgery? Well, the surgeon cuts the transverse carpal ligament. They do this with the intention of relieving pressure on the carpal tunnel. But if it wasn't guilty in the first place, why are we cutting it out? It's madness. If your issues were coming from the entrapment of a nerve at one of the other railway stops, wouldn't you want to know that before you went under the knife? So if the transverse ligament isn't guilty, who is? Adhesion. I'm going to say it again. Adhesion. Let me tell you a story about adhesion. A few years ago, I worked with a woman in her 30s. For HIPAA reasons, let's call her Betty. Now, Betty was having terrible pain along her whole right side. Her neck hurt, her shoulder ached, her forearms felt brutally tight, and she had a burning pain in her hand. She found herself getting really irritable with her partner and her kids at the end of the day because she just couldn't shake her pain. Now, Betty usually enjoys cooking and baking, and she's a chef by trade, but she was avoiding gripping the pan handles and avoiding chopping veggies because she told me that it was so painful. And she came in on a recommendation from her coworker, and she told me that stretching makes things better for a minute or two, but it doesn't really help long term. Also, she was doing some yoga, and that was giving her a little bit of pain relief, but the pain just kept creeping back, getting worse at the end of each workday. And she found herself not even really wanting to do what she does at the end of the day, like just blogging and Facebooking and kind of catching up with her friends at night because her wrist hurt and she just didn't want to get onto the phone and onto the computer. Upon exam, I discovered limited range of motion in her neck, tenderness to palpation at several areas of her cervical spine, and adhesion in her scaling muscles. The median nerve rail line makes a stop at the scaling muscles, and in Betty's case, those muscles were effectively glued down to the median nerve, squeezing down on it and sending symptoms all the way down to her hand. So let's back up for a moment. When any muscle is constantly or repeatedly contracted, and I'm going to say that again, when any muscle is constantly or repeatedly contracted, it becomes deprived of oxygen. Under these hypoxic conditions, free radicals start to form. Free radicals are sensitive and specific triggers for chemotaxis. I love that word, by the way, chemotaxis. It basically means the movement of a cell because of a change in concentration of a particular substance. In my mind, I picture a very small, colorful taxi carrying tiny cells around, piloted by mastermind chemicals. Whatever it takes to help pass boards, right? Anyway, the free radicals invite inflammatory cells to rush in and repair the damage. The cells throw down collagen cross bridges and basically glue the muscle fibers to each other in an attempt to repair the damage. Adhesion is the result. Under a microscope, normal muscle fibers are oriented in pretty much a parallel direction, as shown in B, and adhesion looks more like a disorganized tangle, as shown in A. And this is how we get swept up in the injury cycle. A constantly or repetitively contracted muscle, remember, constantly or repetitively, this kicks it all off, and if not attended to, adhesion just keeps building up. We need to break the cycle and address the adhesion, and I will talk later about how to do that. Once adhesion develops, it does not respond to stretching or ice or ibuprofen. In fact, if you try to stretch a muscle that has adhesion in it, it's analogous to trying to stretch a rope that has a knot in there. You may get a little bit of stretch on either end, but you're just going to tighten up the knot. You need mechanical pressure to break down the adhesion. Studies have shown that it takes 6 pounds of pressure to break adhesion. So that's the bad news, that adhesion is in there. But the good news is that adhesion is treatable. In fact, it's the number one most underdiagnosed pathology and also the number one most treatable pathology. So back to Betty. She was stuck in the injury cycle. It all started from lots of stress at work and always holding her head down and forward and general overuse of her right side. She told me that she always finds herself cocking her head over to one side as she chops. And over time, that repetitive posture and repetitive motion created adhesion in her neck muscles. I treated that adhesion for 8 visits over the course of 4 weeks. And after 1 month, she was ecstatic that she could cook and bake again without pain. And she had tons more energy and patience with her kids. Best of all, she no longer felt pain when she was working for long hours on her laptop. So how do I treat adhesion? I'm about to share that with you. I've blended several tools and techniques that I've learned from other experts to come up with something that I call the Baird breakdown. So there's 3 steps. Step 1, find it. Step 2, fix it. And step 3, forget it. Before you fix something, you have to find it. I examine all the rail stops that could be involved along the path of the median nerve. Things like the neck, the upper back, shoulder, elbow, forearm, wrist, and hand. I test for range of motion, posture, palpable adhesions, and I also do specific orthopedic and muscle tests. Once I locate the adhesion, I can move on to treating it. Treatment consists of manual therapy, specifically designed to apply the correct amount of force in precisely the right direction to physically break down the adhesion. If I've found a misalignment in the spine that is further contributing to the problem, I'll deliver a gentle adjustment to realign the spine and take pressure off the nerve. And then I perform neuromuscular techniques to help the brain-body connection remember its new state. Usually, if things have been going on for a little while, once you start to break that pattern, the body needs a little bit of help to help it find and maintain its new normal. Once I fix something, I want to keep it from coming back. I want to forget about it. This is achieved through a combination of several parts. First is home therapeutic exercises. These are designed to strengthen, stabilize, stretch, or release the desired structures. Second is teaching my patients postural awareness, and this is more than just sit up straight. Third, I teach my patients to use a variety of self-muscle release tools. That way, when a particular tightness starts to build up again, they have the tools and they have the knowledge to address the situation at home without having to enter into the injury cycle again. And finally, I educate them about their specific injury in terms of why it happened and how to best keep it from coming back. And also, I'll let them know what to do if it does creep back. So we have to go through all 3 steps. You can't fix something that you haven't found. To illustrate the importance of this, I want to introduce you to Rose. Okay, so her real name is not Rose, and that's not her picture either, but I like to stay HIPAA compliant, so you get the idea. She came into my office with pain, tingling, and numbness in her right hand, especially worse when she was working on her computer. It was keeping her up at night. The braces that her doctor had prescribed did not seem to be working at all, and she was frustrated that she couldn't do any push-ups or planks or anything on her wrists in her boot camp and yoga classes. On Rose's exam, her wrist, neck, and shoulder were all clear, but I found loads of adhesion in a particular spot in her right forearm. She was surprised when I pressed on the adhesion because it mimicked the symptoms that she had been feeling in her wrist. She told me that she'd been trying to do some self-massage on her wrists, but just hadn't been successful in finding the cause of the pain. The adhesion in Rose's forearm was in the Pronator Teres muscle. This is a muscle that gets chronically overworked when you hold your wrist in a face-down position over a computer keyboard. And guess what? The median nerve runs right through this muscle, and it was getting glued down by adhesion. We got started breaking up the adhesion using manual therapy, and after just a few visits, she'd already noticed that her tingling and numbness had decreased, and it was no longer keeping her up at night. When we had finished the treatment course, she was able to return to her computer work with no pain. If your injury is caused by adhesion, the only way to break out of the injury cycle is to find the adhesion, break it down, and then keep it from coming back. I wish that 10 years ago, when I was struggling with my own injury and not getting any answers, I had known what I know today. Now, I can't go back in time to help myself, but I can very likely help you now. My gift to you today as a thank you for being here is a free injury consultation session. I'm offering you the chance to have a one-on-one conversation with me to find out if and how I can help you resolve your injury so that you can live your life without pain. I've opened up 10 spots on my calendar, so if you want to get rid of your pain, be able to exercise and perform your hobbies with more enjoyment, and put an end to your frustration at going through the ringer, claim one of these spots right now. And remember, if your problem is due to adhesion, you don't have to live with it. Let's find it, let's fix it, and let's forget it.